Welcome back. China has helped many developing countries, particularly in Africa, in the battle against the coronavirus. It has sent a vast amount of medical supplies and assistance to more than 50 countries on the continent, as well as to the African Union. For more, let's go to our Nairobi bureau. Richard?
Yes, indeed, Gas. Let's get you up to speed with the latest developments. Sudan has reported over 6,000 confirmed cases of COVID-19, which is the highest number among Eastern African countries. A national curfew and traffic restrictions have been imposed to control the spread of the virus. Currently, a Chinese medical team is in the capital, Khartoum, to share its experiences when handling the coronavirus. CGTN's Weiwei is traveling with the team and has this report.
The Chinese medical team arrived in Sudan on May 28th, and they have a lot of work to do here. So for the past several days, they met with officials from the Health Ministry, as well as the Higher Committee for Health Emergencies, which is a national cross-department body for the COVID-19. Besides that, they also visited a number of hospitals here, where they held in-depth talks with the local medical personnel, and also they visited patients of the COVID-19, not only those with mild or moderate symptoms, but also some severely ill patients inside the ICU. And besides that, they also held talks with members of the WHO office in Sudan, as well as the Organization of Doctors Without Borders. Earlier, I talked to Sudan's health minister, who talked about the Chinese doctors' work here, as well as the challenge that Sudan is now facing.
This is a very important visit for us, and we're very glad to have our colleagues in the health professionals from China, particularly in what was the overall experience of how the state of the city of Wuhan and other parts of China, and how the national response faced the epidemic, addressed it, suffered a lot, but that faced it in a very strong way, a very comprehensive way, with strong leadership locally and nationally, so to the extent that today in China we are seeing that this is no longer a big challenge. That kind of journey is what we are very keen to learn. When will we get to that stage? I would say the second most important part, how do you treat it? How do you identify it? And how do you make sure that the rest of the health services for people who do not have the disease are still continuing?
And currently, we know that Sudan has the highest number of confirmed cases of COVID-19 among Eastern African countries. So what are some of the challenges that your country is now facing?
I think the biggest challenge we face in Sudan is the importance of further strengthening and restricting mass gatherings and the movement of people within cities, within states, and between states of Sudan, and making sure that we really close the border in a very strong way. If we are able to do that with stricter measures, then I think we would be able to then start looking at a lower number of new cases and also a better ability, therefore, to control it.
Right now, are we facing the shortage of medical supplies or medical personnel at the moment?
If I ask now how much stock do we have of masks, gloves, personal protection equipment, I am sure we will have no more than 1 month's supply at the current numbers of cases. So when we talk about corona today, we always see corona, but then corona came on what kind of situation where we have to deal now with not just the corona, but other diseases, other supply shortages, funding for our health workers, and funding also for the medicines that non-corona cases need all the time in the amounts that I mentioned. And our government is working very hard to make sure that these inputs are provided either from the government's own budget, which is really constrained, or from international donors like China.
In terms of this issue, for the past several decades, China has been consistently providing medical aids to African countries, including Sudan. So how do you see China's role and responsibility in this matter?
Being the first country that was affected, you gained and developed a lot of good experience, and you turned the epidemic around. The second most important thing that China can also do in the context of general health services is that China's investments, we would like to add a dimension whereby a Chinese university or a Chinese number of professionals can come to Sudan, provide the technical support, or a Chinese businessman or businesswoman can come to Sudan and invest in infrastructure that relates to health, or invest in a joint venture in producing the kind of equipment and medicines and personal protection equipment that I just mentioned. I hope can start a kind of people-to-people diplomacy that would, in my view, for the country of Sudan, be much more beneficial than a relationship that goes only through governments. That one should also continue, but it should not be the only one.
There is still 1 week ahead before the Chinese medical team complete their mission here. And before they leave Sudan, they will deliver a report on their suggestions on different issues, such as the prevention and control of the COVID-19, such as the treatment and also the hospital management and so forth. This report will be delivered to the Sudanese government. Weiwei, CGTN, Khartoum.